You're watching this video because you're scheduled for an arthroscopic rotator cuff repair. I made this video so you'd have a reference to understand a little bit about what we're doing during the surgery, but also to go over a lot of the things that we're going to want you to do after the surgery. So the surgery itself will be arthroscopic. I will repair the rotator cuff. You'll go home the same day. After the surgery, we'll put you in the sling. I want you wearing that sling full time for 6 weeks. So that's both day and night. The only time I want you taking off the sling is to do your exercises, work in physical therapy, or take a shower. So during that time, I don't want you using the arm. So every time you take the arm away from the body, you stress the repair, and if you do that too much, then the repair will not heal. Things that are okay for you to do with that arm is working on a computer, using the hand, using the fingers, reading a book, working a phone. That is all fine, as long as it doesn't involve you bringing your arm away from the body. So during the surgery, there's a lot of things that we're going to do to help you out with your pain. You will meet with the anesthesiologist prior to surgery, and they will talk to you about doing a block. That's where they inject some numbing medicine into your shoulder. That usually lasts for about 1.5 days to 3 days. I will also inject some numbing medicine around the shoulder itself. That will help for about a day, 1.5 days. We'll send some medications over to your pharmacy, so pick those up prior to your surgery. You're going to have 2 different types of pain medications. There's going to be your narcotics and your non-narcotics. The non-narcotics are where I want you to start. So that's going to be diclofenac is your anti-inflammatory, Tylenol is your pain pill, and gabapentin. You'll take the gabapentin at night before you go to bed. And these instructions will go home with you after the surgery. Ice, ice, ice. Ice packs, ice machine, whatever you got, be aggressive. I want you using that about 20 minutes on, 20 minutes off for the first few weeks after the surgery while you're awake. If all of that's not enough and you're still having pain beyond that, we did give you a prescription for a strong narcotic. It's called oxycodone. Take it if you need it. If you don't feel like you need it, you do not have to take it. It is purely for emergency purposes only. It's if you don't feel like your pain is adequately being controlled, then that medication is there. If you do end up taking it, I would take a stool softener with it, as it has a tendency to make you constipated. Additionally, with any surgical procedure, we always worry about blood clots. So after the surgery, I'd like you taking a full 325 milligram aspirin every morning for the first 2 weeks, and also wear the compression stockings that we put on you after the surgery. Both of these will help prevent blood clots after your surgical procedure. If there are any questions about this or anything else, please feel free to give us a call and we can discuss any issues you have over the phone. Thank you.